Chair McMorris-Rogers, Ranking Member Pallone, Chair Guthrie, Ranking Member Eshoo, members of the committee. Thank you for the opportunity to testify today. It's an honor to be with you this afternoon. On behalf of Families USA, a leading national, nonpartisan voice for healthcare consumers, working to ensure the best health and healthcare are equally accessible and affordable to all, I want to thank you for this critical discussion on healthcare affordability, transparency, and competition. Today's hearing is urgently needed. Our healthcare system is in a crisis, evidenced by lack of affordability and poor quality. It will take all of us working together across political parties, from rural and urban communities alike, to fix it. Every person in the United States should have affordable, high-quality healthcare that prevents illness, allows them to see a doctor when they need it, and helps to keep their families healthy. Yet almost half of all Americans report foregoing medical care due to the costs. A third say that the cost affects their ability to secure basic needs like food and housing, and over 40% of American adults, 100 million people, face medical debt. Unaffordable health care is a persistent problem for national and state governments and affects the economic vitality of middle-class and working families. Despite this financial burden, our health is not better. Our moms and babies die at higher rates, and 250,000 people a year are killed by the healthcare system from medical errors, infections, and the like. Make no mistake, America's families are suffering, and swift action is needed. At its core, this crisis is driven by a misalignment between the business interests of the healthcare sector and the health and financial security of our nation's families. Healthcare industry consolidation has eliminated competition and allowed monopolistic pricing to push our nation's families to the brink of financial ruin. Americans have all watched as their local hospitals have become health systems, and those systems were bought by large healthcare corporations to increase prices year after year. These higher prices are passed on to families as annual increases in insurance premiums and cost sharing, and become profit margins for large hospital corporations. Since 2015, hospital prices have increased as much as 31% nationally, now accounting for nearly 1/3 of US healthcare spending, and growing 4 times faster than workers' paychecks. And these prices are irrational, with a knee replacement costing 3 times as much in Sacramento, California than in Tucson, Arizona, and an MRI at Mass General Hospital in Boston, Massachusetts, ranging from $800 to $4,200, just depending on the insurance carrier. Particularly concerning is that healthcare is one of the only sectors in the US economy where consumers are blinded to healthcare prices until after they've received a service and a subsequent bill. This lack of transparency is a major barrier to the healthcare sector competing based on fair prices and high-quality care. But it doesn't have to be this way. We know what's driving the crisis, and we know how to fix it. Solutions can be deployed right away to end these pricing abuses, restore competition, and make healthcare more affordable. We urge the committee to consider well-vetted, bipartisan solutions, including strengthening codifying price transparency rules, addressing payment differentials that incentivize consolidation and drive up costs, and limiting anti-competitive behavior in provider and health plan contracts. Ultimately, the healthcare sector's economics must change to align with the health and financial security of the American people. Congress has overwhelming public support to do this. 93% of Americans agree that we pay too much for the quality of care that we get, and 9 in 10 voters believe that Congress should act to reduce hospital prices. I'd like to finish my remarks with the story of Kungi Lee from Ohio to illustrate just how anti-competitive these prices have become. Miss Lee has arthritis, and once a year goes to a rheumatologist for a steroid injection in her hand to relieve her pain. Each round of injection costs her $30. But in 2021, when she arrived at her usual office to see her regular rheumatologist, she found they had moved up 1 floor in the building. She thought nothing of it until she received a bill for nearly $1,400. Ms. Lee's infusion clinic was moved from an office-based practice to a hospital-based setting, resulting in a price increase of more than 4,500% for the exact same service from the exact same provider. This is a national scandal. This committee has the power and responsibility to stand up for our nation's families and stop pricing abuses driven by big healthcare corporations. I thank the committee for your time and look forward to answering any questions you might have.
Sutter Health is really dominant in my congressional district, and they have a new CEO that came in and met with me maybe a few weeks ago, 3 weeks ago, something like that, very recently. And before he even asked me what I had on my mind, I told him. And at the top of my list was that they were turning away new patients with traditional Medicare, but accepting patients who have Medicare Advantage and private insurance. Obviously, I don't support that. I don't support that practice, and these complaints have come from my constituents. When I asked him about it, he said that as they move to hire more doctors, that policy would not remain in place. But when we circled back with them, they had changed their mind about it. Not a good policy. Is this, in your view or your understanding, is this a common practice of health systems nationwide?
Thank you for the question, and I would agree that's outrageous. I think it's just another example of how broken the markets have become, where we have large systems like Sutter with dominant power, and they're able to make all kinds of decisions about prices, turning away patients because of the types of rates that they're getting. So it's completely unacceptable. I would agree.
Well, what it is that the privately insured are favored over the publicly insured. So how would you address that? What would you recommend this committee on a bipartisan basis to do?
If you can kind of sum up there.
I think it's the very solutions that we're here to talk about today.
You can respond in writing to me in length.
Okay.
Thank you. Thank you, Mr. Chairman.
Yeah, we want to hear a response.
Yeah, we need the response.
To your knowledge, what efforts are being made to ensure that non-English speakers can still have the same tools at their disposal to make informed decisions?
You know, I'm not sure about the answer to that question right now. I'd have to look it up after.
Okay, thank you very much. Does anybody have an answer to that question? Please.
I think on the price transparency requirements in particular, my understanding that there's not a requirement for the information to be in any other language other than English.
Ms. Tripoli, can you discuss some of the challenges patients face in navigating the health system and how increasing transparency can help patients achieve savings?
Absolutely. Thank you for the question. I think there are two. The big purpose of price transparency is that we have a system where we actually don't know what the prices are until we get a service and we get a bill. Price transparency helps to crack that wide open. The most important pricing information that we need in price transparency is a negotiated rate. That's the rate that's being negotiated behind closed doors between dominant health systems, hospitals, and plans, and then it's buried in proprietary contracts with no insight or oversight from the public. Pulling out that information gives patients the ability to say, I want to get my MRI for $80 at this facility and not for $3,000 at the one half a mile down the road. It has direct ability for consumers to be able to shop and also for policymakers to be able to intervene where prices have gotten too out of control.
Thank you. You know, and I agree, patients deserve greater transparency in the prices they pay for health care. But right now, despite the transparency rules that went into effect in January 2021, it is still difficult for consumers to access pricing. So, Ms. Tripoli, in your testimony, you discussed how some hospitals are failing to fully comply with the hospital price transparency final rule. Can you briefly discuss how hospitals' failure to fully comply with the provisions of the final rule is making it difficult for consumers to access critical information on pricing?
Absolutely. I think that it's just another example of the gaming of keeping prices hidden, how broken the markets are, that this pricing information is incredibly valuable to hospitals to keep hidden so they can increase prices year after year with no insight or oversight from the public. So I think being able to pull down the pricing information is critical. We're seeing hospitals doing everything from not posting any pricing information to posting a price as a percentage of Medicare, for example, 120% of Medicare, which is meaningless for most consumers. They're publishing information in various formats that are not usable or machine readable. They're using a lot of NAs as examples as well.
Yeah, so what are some ways Congress can further strengthen the final rule?
Congress absolutely should be strengthening and codifying, including, as we've heard some of the testimony already today, about creating more standards around the format, outright prohibiting hospitals from being able to post anything other than a dollar and cents amount. The actual price is what we need. More streamlining around the names of services so we can actually compare and understand what the services are across hospitals. And I would also say that increasing the fine for hospitals that don't comply. The $2 million max fine is not sufficient to incentivize most hospitals to comply.
I would also add the out-of-pocket costs for patients as well, given the different health insurances that are out there. I continue to be concerned with the reports of low hospital compliance, and I believe Congress needs to further strengthen the regulation. I believe we also need to couple transparency with policies that will further expand coverage and lower healthcare costs. So, Ms. Tripoli, can you discuss how the subsidy expansions included in the Inflation Reduction Act are helping lower cost for families?
Absolutely. I mean, the bottom line is that our families are facing a healthcare affordability crisis. The extensions of the subsidies that were passed through the IRA were critical to be able to support families in a moment when 100 million people are facing medical debt because they can't actually afford the cost of care. So we absolutely should be extending those subsidies to continue to support families, and we also have to address the root problem of what's driving our affordability crisis. It's prices. It's predominantly driven by prices by hospitals due to unchecked consolidation from the last several decades. And so it's really, it's critical that it's both and. We have to also look at the root causes to address the affordability crisis.
Well, Ms. Tripoli, I'd also like to hear your perspective on how hospitals can make it easier for consumers and employers to compare prices for services and make informed decisions.
Absolutely. I think first and foremost, we got to get all the hospitals complying with the basic rules, and we know we've got a lot of work to do to be able to get there. I think part of that is making sure we're having more standardization across what the required services are, so that when you're looking for an MRI in one hospital, that same MRI is showing up in another hospital. There's a little bit variability right now. And I think the other piece to point out is we also have to clean up the data files. Like, we have to actually have prices. We have to have the same standard way for how we're describing services, so that consumers can actually understand. Most folks don't know what a CPT code is, so we need a description to explain, well, what does that mean? Exactly. And what price am I getting for that service?
What do you think the obstacles are to preventing this compliance?
Thank you for the question. I think at the end of the day, it's just about the business model of the sector, which is to keep prices hidden so that they can continue to increase prices year after year on the backs of the American people. There is not a strong enough financial incentive or requirement to get prices, disclosed prices, because that pricing information is the most valuable piece of information in the hospital business model. So price transparency, unveiling prices, requiring the negotiated rate to be disclosed for the public is hugely powerful. It disrupts the status quo, and it actually allows policymakers to make targeted decisions about how irrational prices have become, and allows academics to understand where is high-value value care occurring, where is low-value care occurring, and then we can make targeted interventions to make sure all people living in this country have high-value care.
So some of my colleagues were asking this question, but I'm going to ask it again as, what can we do to help encourage that compliance? You said there's no incentives. Do we penalize? What specifically would you recommend we do to start to increase this compliance number?
I think strengthening and codifying the rule into statute is a step in terms of strengthening on top of the requirements that are already there. I think specifically prohibiting hospitals from posting prices as a percentage of Medicare or a percentage of gross charges. So we actually need dollar and cents.
So talk in English?
Exactly. In English, to that point, we actually need to understand beyond a confusing code that most folks don't understand what that is, a description that puts things in layman's term. What is this? We need more standardization across the services that we can actually compare apples to apples and not oranges to grapefruits. And I would say the other piece that has not been mentioned yet is we need quality information. The only way to assess high-value care is if we have price and quality together, so we can determine is that a value product, and are we getting our money's worth for that?
Thank you. And I should have said Spanish or French, or layman's language is a much better word.
In your opinion, what could be done by CMS or the executive branch to better ensure compliance with the hospital price transparency regulations?
I think at the end of the day, this is about hospitals failing to comply. They have the requirements. It's a federal rule. We've been in implementation for 2 years. At this point, we would expect to see much higher compliance, and not just the posting some prices, complete data files. So I think at the end of the day, this is about hospitals showing up and doing their part and complying with federal rules.
Ms. Tripoli, where is access to care most threatened due to the limited market clout of smaller community hospitals?
I think at the end of the day, what we know about the markets is that these large dominant systems are able to buy up independent physician practices, and that is one of the greatest trends we're seeing right now in terms of vertical integration. And that has a direct impact not only on prices, but also access to care, particularly primary care, for many of the communities around our country. And so one of the solutions we can do right now to end one of those incentives for big systems to be buying up smaller doctors' offices is to expand site-neutral payments, which will also result in significant savings for the system and also for the beneficiary.
So my follow-up question to that was that I am exploring policy solutions to address this access to care challenge that is disproportionately hurting low-income communities, especially in the district I represent. So if you could share some of the challenges facing smaller community hospitals and some of the ways that we can improve reimbursement for these kinds of hospitals, that would be helpful.
Well, again, I think one of the things we can do right off the bat, which is what is under discussion for this committee here today, is expanding site-neutral payments, which eliminates this perverse incentive for big systems to buy up independent doctors' offices, which has a direct impact on making sure that we have access to critical care in communities. The other thing that I would just say is one of the other things we're seeing in terms of dominant market power is a lot of anti-competitive practices, including restricting providers from being able to go to competing systems, which has also a direct impact on access to care in communities. So I think taking a closer look at the different types of anti-competitive practices that are occurring between plans and providers and prohibiting some of those practices that we know that lead to burnout, reduce access to care, drive up prices, and result in poorer quality care.
Ms. Tripoli, Families USA has supported these site-neutral payment policies because they will save consumers money. How would changing hospital billing for clinically appropriate services help lower costs for patients?
Absolutely. It's really about just reducing, eliminating an incentive in the payment, the way we reimburse for care that drives towards higher cost outpatient care and allows hospitals, when they acquire physician practices, rebrand them as outpatient facilities. They then tack on a facility fee, which consumers are paying directly, thousands of dollars. I think we've seen from a variety of different projections, from MedPAC to CBO to the Committee for Responsible Budget, significant savings, not just for the system, estimates up to $153 billion over the next decade, also would include lowering premiums and cost sharing for Medicare beneficiaries by $94 billion, and for those in the commercial market, up to $466 billion. It's a no-brainer in terms of cost savings for the American people.
So what's the most single important thing to make sure that patients know about how their healthcare dollars are being spent?
Well, I think you really nailed it, which is there's been an incredible shift over the last 60 years. Hospitals that used to be these community-based institutions have emerged into these mega cost centers, and communities have watched their local hospitals disappear. It's a major problem. It's the #1 driver. It's one of the biggest drivers of unaffordable care in the form of higher prices. So I think for consumers, it's knowing that. It's knowing that their local hospital doesn't exist anymore, and so we need to think about the types of solutions that we can implement that are going to bring down the cost of care for the American people. It's the very solutions we're talking about today in terms of strengthening price transparency, codifying that rule, expanding site-neutral payments.
Right. Well, good. Thank you.